Welcome back to Pittsburgh Living on KDKA TV. I'm your host, Carol Lee Espy, and today we are featuring 8 excellent tri-state businesses. We have St. Anthony's School, which will help your kids, and we have PPG Paints, which will help choose the perfect color for your house. We have Three Rivers Spine and Pain, which will help your aching back. Aspen Dental will give you a new smile, and New Image Hair Clinic will give you a new look. But right now, we'll welcome Dr. Ian Bulow from Revive Upper Cervical Health Center. Welcome to Pittsburgh Living.
Thanks for having me.
And I love when you come in here because it's always so interesting. I get this little education on what the upper cervical part of your spine is.
Yeah.
And what is it exactly?
Sure. So upper cervical care is a growing specialty within the chiropractic profession. And when you look at areas of the spine, the cervical area of the spine is the neck, essentially. So it's kind of upper neck care, if you want to think of it like that. But it's a very meticulous, very precise, very gentle form of care that deals with the point where your head and your brain are trying to communicate with your body.
That's where it all is, right there, in the brainstem.
And what we find is that when people have misalignments and instability in their neck, it usually sets the tone for the rest of the body.
Yeah.
So even though most people would associate us with neck and back pain and headaches, what we find is that pressure here can lead to a vast array of chronic health issues.
So let's talk about one issue that we haven't even discussed before, and it is fibromyalgia.
Yeah.
What exactly is that?
Yeah, fibromyalgia is one of those conditions we see a lot of and we get great results with it. And one of the reasons we get fantastic results is that most people are lost when it comes to fibromyalgia. They usually will suffer for years before they're even properly diagnosed. And about 20 to 30% of the cases report it starting in childhood. So they're just kind of passed off as being a problem child, or it's just in your head, or you're just kind of depressed or stressed out. You really don't have a legitimate pain syndrome. But now what we're finding with the arthritis foundations and the rheumatology groups is that it's a very legitimate pain syndrome. And that's what it is. Fibromyalgia is classically diagnosed as widespread chronic pain.
Which is horrible to live with.
Yeah, absolutely. And it's usually housed in the larger muscle groups, so in your shoulders, in your lower back, in your hips, coupled
you're just
with
feeling it all the time.
Yeah, all the time. And it leads to chronic fatigue. People with fibromyalgia don't usually get a restful sleep. So you can sleep for 10 hours, but you wake up and you're still tired. And again, we find, and what most neurologists and rheumatologists are finding, is that the root cause of the fibromyalgia is a disconnect or a misfiring of the central nervous system, the brain and the spinal cord.
Which is all in the base of your spine.
Which is right there. So there's two reasons,
again.
there's two big reasons that upper cervical gets great results. Number one, we're dealing with the spinal cord and the quality of brain messages. And number two is that if people have a misalignment at the weight of their head, they tend to compensate with their shoulders and their back, which leads to a lot of shoulder pain and reoccurring back and hip pain. Again, the classic symptom of someone with fibro is they might do limited success with standard medications, therapies, even chiropractic adjustments down the spine. But if the weight of the head, we find, if the weight of the head isn't centered perfectly, those issues tend to come back.
Well, you think about it, from the day that you're born, the biggest thing on you is your head.
Yeah.
And you have this neck and underdeveloped muscles that are supposed to hold everything up.
Yeah, and that's what we tell families when a patient comes in with fibromyalgia. If they have a child that is in sports or is active, we recommend having the children checked for a baseline examination. Just like you'd go and have blood work done, or you'd go and have your regular checkups. Having the spine checked from a very early age is a really smart thing to do.
So what happens when someone calls you, they make the appointment, they come out? What is that examination?
Sure. So the first things first is we want to sit down and do a very thorough consultation. You know, I can help, to be perfectly honest with you, a lot of different people physically, but our form of care is very specialized. And what we have to determine is if someone is mentally ready to really get well. It sounds silly, but it's the truth. We can help a lot of people, but the hardest thing is really someone deciding, you know what, I'm going to get better today. I'm done with this garbage from before. And so we set aside a very thorough consultation time to make sure we're on the same page with our patients, because we know them like family, and we really want to be, we're there to help them. And then from there we move forward. You know, there's consultation, there's, examinations, x-rays, thermography. It's all very precise work that we do, but it's one step at a time. And the first thing is a consultation process.
Okay. Now, we talked about concussions.
Yeah.
With a lot of young people.
Yeah.
Every sport are suffering from these.
Sure.
And you've been having great success with concussions.
Yeah, I wanted to mention that because with the spring sports coming up here, we
Yeah.
just started just last week a couple of MS patients, but then also 2 young adults with post-concussion syndrome. And what we're finding with these kids is that they're, just like fibromyalgia, suffering for multiple years before they find our office. And I would have to tell you that probably we get over a 90% success rate with post-concussion syndrome, especially in the high schoolers and the college kids. They respond really, really quite well.
And it's something that we see quite a bit of. And now that they're doing the baseline testing,
Sure.
they actually know where they're starting from.
Absolutely. The impact test is a great test. What we do is infrared thermography, so it measures physiology. So the impact test will measure brain function here. We're going to measure total inflammation at the point where the brain is communicating with the rest of the body.
Wonderful. And non-invasive.
Non-invasive at all. And I would say if people are interested, one thing is we have not only our consultations, but we're starting a monthly educational series where we're bringing in other providers. So very soon, on Monday in fact, we are going to have the Hormone Center joining us, and we're going to do a whole seminar on fibromyalgia and other chronic fatigue syndromes and things like that. So whether someone has post-concussion syndrome or any chronic health issue, if we can't help them, we're networking with other specialists in the area to make sure we get these people well. Yeah.
Well, thank you for being here. It's
Absolutely.
always interesting.
Thanks for having me.
Now, you would like to know more about Revive Upper Cervical Health Center, you can call Dr. Bulow at 724-772-7060 or log on to revivepittsburgh.com. Up next, we are going to talk with Mark Sieg from St. Anthony's School. That is next when Pittsburgh Living continues.